Hi, I'm just Paddy B,
And I'm Farron.
and in this video, which is part 3 of 3 on our discussion about healthcare, we will be comparing the UK to the US. Hopefully, by the end of this video, we can give you an answer to whether the system in the UK or the US is better. If you can please leave a comment, give us a like, and subscribe, that would be amazing. So obviously there was parts of the UK video I didn't talk about. I didn't talk about the private healthcare that you can get in the UK. And that's because I think it's the only thing that is slightly comparable to the American system. However, there is caveats to that. A lot of stuff in the healthcare in the private sector in the UK is still ingrained into the NHS. If you pay to see a consultant, if you pay for your private healthcare, you will still be part of the NHS system. Somewhere down the line, you'll see someone in the NHS. If you go onto your list for surgery, that's still going to be part of the NHS, but you can pay for it privately. So what you're basically doing there, to bring an analogy into gaming, is you're paying to win, because you're paying money to get onto a list higher up. That's what you're doing. So there's nothing wrong with that. If you've got the money and you're forking it out, oh well, I guess that's just the way it is. It's more money.
Yeah, that's what you want to do.
More stuff. But it's the only thing that's even slightly comparable to the US. However, because it is so ingrained into the NHS, you're still not forking out thousands for things. You might be paying a couple hundred. You might pay a couple of thousand if you're trying to push along a surgery. But for eye care, if you had a problem in your family, you can get the test for free. You just have to pay for the frames and the lenses. If you're in a full-time education, you can get free eye care. You can get free dental treatment. If you're over 65, you get the same perks. So there's perks within the NHS system that allows you to get certain things for free that you cannot get in America. So where it comes to comparing the both, you realistically can't. I'm assuming that the Farine next to me would agree with that statement.
100%. Especially with the eye care, there will be systems in places that will allow the insurance companies to cover certain costs for the actual prescription itself, and then they may or may not, depending on which glasses you choose, cover 10-20%.
Right.
So, and then of course we're talking 10-20% of $300 to $400.
Is this for the frames or the lenses?
For frames. For frames.
What about lenses?
They're separate. It depends on what kind you want. You want the scratch free, you want the reflective, that kind of stuff. So that all adds onto it, and that all comes out of your pocket for those lenses themselves. So,
and then you claim it back, or do you not get anything?
There's no claiming back. Okay. That is straight out of pocket cost.
Okay. So obviously, there is just non-existent eye care freebies or dental care in America.
Just be slight reductions depending on, and if you're in good with the doctor or the dentist that you got, and you got a good insurance plan that'll cover everything you need, you may get reductions in cost. All right, okay. But you still have to pay your copays, and yeah, that's always a good thing.
Yeah. So obviously trying to compare is really difficult, so all we can really do is give the good points in the system and then just tell you guys what we think and which system is better. So if I start with the UK, I would say my first point is that it's a clear and understandable socialized system. We know that we get it free. We know that with our taxes and with our benefits and with things, we can walk in the A&E, we can walk in, do our GP, and we don't have to pay anything. We know that with it being the way that it is, that it's not going to bankrupt us. So that leads very well into my second point, which is that everyone is entitled to free healthcare. We do get free healthcare in this country. There's parts of it that isn't free, the prescriptions and stuff, but that's just certain ways that they can make their money back. There's certain drugs that the NHS pays for that they pay 120, 200, 300% more than what we pay for prescriptions. This is all based on our generalized taxes. So if you're paying income tax, you're paying national insurance, which is obviously the main tax for your healthcare. But then all of your taxes goes towards it. It just then the government then allocates the billions that they do to the NHS. Obviously, it's really sad that the NHS has not getting certain money in certain places that it does, but there's a lot of politics and bureaucracy in it that would just inherently slow anything down. And my third point is the inexpensive set cost for prescriptions. So obviously at 9.15 as of the 1st of April of this year, and that's what they were set at. That price is a good price when you compare it to the likes of America, because how much do prescriptions cost in America?
Couple hundred.
Easy.
Without even trying. There's on a monthly basis, I'm having to fork out a couple $100 just for medications,
which is just really just unfortunate.
Yeah.
So that was the main good points that I have for the UK healthcare. I mean, there's more than I can get into. The way that they've handled the global crisis right now is just, it has to be up there. But obviously, we're comparing the systems. So if I hand over to Farun to talk about his points.
Yeah, so some good points for the American healthcare system. They have there's a high level of healthcare for those that can afford it. Yeah. Unfortunately, the costs for healthcare is dependent on location, like real estate.
So obviously, the problem with the American healthcare system is that there's not really many good points. So you have to list the points of the healthcare system. So you're basically listing the main points of it. Yeah.
Yeah. I mean, America does do good in medical research.
Yeah.
We have the CDC. Among others, the AHA, American Heart Association, which helps us with our BLS and CPR certifications across the globe, or the states, as far as every employer has got to teach that and have that for their employees, which goes into the basic first aid as well. So they do have that program as well available. Yeah, and then of course some of the things that I wish that they kind of would refocus their energy on is reduction of the costs of prescription drugs.
Yep,
that's a big one. So overall, I think that the U.S. healthcare system is overcomplicated and expensive.
I think that's a massive just understatement. I think it's there's so many different systems. Like even trying to wrap my own head around
Medicare,
Medicaid, HMO, whatever this
the private insurance that covers the HMOs and the PPOs,
which TRICARE,
the TRICARE for government funded programs. So TRICARE kind of works into, if you're a federal employee, you can get and your benefits go to you and your dependents. That work with the federal government, and you get actually that system is actually a socialized healthcare system, but it's enclosed inside the federal employee program.
Yeah, and then you have the Affordable Care Act.
Yeah.
So it's just overcomplicated. There's too many systems, and not all of them are working, and it's just yeah.
And then of course the second point: not everyone is entitled to free healthcare. So if you're down on your luck, you don't have health insurance, there's a law set that they can't turn you away. They have to treat you.
But they'll bankrupt you while they do it.
But they'll send you a bill on the way out.
So they'll bankrupt you.
Yeah, exactly. I mean, over the course of the last 6-7 months, there are many families that are now unemployed, don't have insurance because they lost it from their employer, and they're getting ill. For many reasons. And they're going into hospitals and A&Es and ERs with issues. They're getting treated, but they're walking out the door with the $15,000, $16,000, $20,000 bill on the way out, which I don't know. I can't afford $15,000 for a 1 to 2 day hospital stay.
Yeah,
I can't afford that. And of course, the last point, the USA is ranked number one. Go USA. For costs per prescription, number one in the world. Yeah. So I mean, you can get your drugs cheaper. I don't know, Cuba or some other country, Italy. There's a lot of places you can get prescription drugs. Canada, they're right there, right next to America. Most Americans, there's been actually a thing where Americans will leave the States, go to Canada, get their drugs, come back.
Yeah, but is Canada not clamping down on that?
They are.
I thought
they
so.
are. The reason why is because the cost of prescription medications, because they're like everywhere else in the world, their costs are for generic drugs. They will sell us the generic drugs to treat our problems. Yeah. Whereas in America, you have to buy brand names.
So the privatized companies that set the prices obviously gets to dictate those prices, which just makes everything a lot worse.
Yeah, and then of course the last point that I think is important is don't let America buy the NHS.
Yeah,
and let's keep it here.
I think for me, it's don't allow politics or bureaucracy to get in the way of the best thing in the UK.
Yeah,
the NHS is the best thing by far that the UK gives to its citizens, and I agree. Don't sell it to America.
Don't sell it. Yeah, because what would America do with it? They wouldn't. They don't have any idea of how to work a socialized system because of the system that they have in place. They've had this in place for years now.
Exactly.
There's too many hands in the pot for them to pull out and be like, you know, we don't want to do this. Too many people are going to lose too much money if they go socialized or they try to change the plan. That's why there's such a big to do in the political spectrum about the single payer system and everybody resisting.
Yeah. So in conclusion, I think we're both saying that the UK healthcare system is far better. There is inherently problems with both systems, but they're from a different point of view. One is just ridiculously bad for its people. The other is great for its people, but at times it's just not managed properly.
Yeah.
I think that's everything.
Yeah, I think that's everything. Thanks again for watching. Give us a like. Comment below if you have anything to add to, or have any questions for us. Hit the subscribe button.
Yep. We're here to interact with you guys. If you want to tell us what we got wrong, I mean, everything we've said here, we've tried to make it as factual as possible, but we could have got something wrong. Just leave a comment below and we'll address it. So, thank you.
All right. Bye.